Hi, good morning, everybody. My name is Keiko Kealoha. I am the Ryan White Administrative Manager at the Hawaii Health and Harm Reduction Center. So I work in HIV care, and I've been working in the HIV field for a little bit over 9 years, almost 10 years. First starting on Hawaii Island and then moving to Oahu at the end of 2021. And so I've worked in many different parts of HIV care, moving through prevention and then into care. So my background is really started with the education piece and the HIV testing and community outreach. Um, I don't know if you folks have seen the people who used to pass out condoms and stuff like all over the place. That was what I kind of started doing. But then I moved into like PrEP navigation, which is HIV prevention medication, and then into case management, working directly with people who are living with HIV. And so I'm really excited that I'm going to get to the chance to share with you a little bit about the work that is being done, and then some ideas around how to mitigate uh, negative experiences from the social determinants of health as a result of colonization. And so today, I'm going to be talking about decolonizing HIV care in ʻŌiwi communities. And so um, I'll just go ahead and get started. So, in order to kind of paint the picture for what it really takes to decolonize HIV care, I am going to go into a brief overview of colonialism and occupation in Hawaii, because as we know, it's actually very extensive. The history is very broad. I will not be doing it justice in this presentation because there's just so much to it. But there are some important things that I do want to highlight because they are relevant today. And then I'm going to go into the sociological foundations of colonial and post-colonial theory. And this is really important to help us frame the social experience of HIV as a disease and a healthcare and a health experience overall. And then I'll go into the health impacts for ʻŌiwi, our ʻŌiwi community in the HIV realm. And the reason why I'm going to go through all of that stuff first is because we really do need to center ourselves in our history in order to understand how we ended up where we are today, and then how to figure out the way forward, right? The path forward. So, a real quick note, I do want to mention, right, there's a difference between colonization and occupation. And I've noticed on social media that this has kind of been popping up a little bit. And so I want to make sure that I honor the two. I might be using these terms interchangeably, but please understand that I am referring to both kind of collectively. Because our literal experience here in Hawaii is occupation, although occupation is usually thought of in a temporary sense, right? Occupation happens when a foreign government assumes control of another, whereas colonization happens when people impose a government or establish a government in land that is quote unquote unoccupied or ungoverned. And the reason I want to talk about that, right, because we have to also think of ourselves as Hawaiians as indigenous native peoples to this land, but with this really complex political history. And so are we indigenous? I've seen some videos circulating from Dr. Keanu Sai talking about how we're not indigenous because we're Hawaiian nationals. But I do want to make the point that what we experience today as native people, as indigenous people, is very like is very telling of the experience of colonialism and the impacts of colonization. So I will be using the term indigenous not to highlight our political relationship, but to highlight the social experience and the healthcare experience of Native Hawaiians today. Um, and so who am I talking about? I am talking about Kanaka Maoli, Kanaka ʻŌiwi, Native Hawaiians. I will be using these terms kind of interchangeably. So please know, I want you to know that I am talking about Kanaka Maoli, Kanaka ʻŌiwi, Native Hawaiians, all as the same people, whether you are, full or part Aboriginal blood, in the words of Keli'i Pauahi in her will. I will be using these terms interchangeably. That's just the heads up. Okay, so from the time that Captain Cook arrived here in Hawaii, and I know that this is going to be just kind of review for some folks, from the time that Captain Cook arrived here in Hawaii, it was just about 125 years until the Hawaiian monarchy was overthrown. And so on this slide, I have kind of real like punctuated timeline. And these bolded items really highlight significant events in our history, right? So to highlight just a couple of them, TB and syphilis arriving really marks the beginning of rapid population decline here in Hawaii. The American missionaries' arrival in 1820 signifies the shift in the type of religion practiced here in Hawaii, and really marks the beginning of a strong and profound cultural shift. In 1825, sugar gets established as an industry, which actually paved the way for land privatization, which is the Great Mahele, and then eventually the signing of the Bayonet Constitution and the ultimate overthrow of the Hawaiian monarchy. So, like I said, I'm not doing this timeline justice here, but those are pieces that I really want you folks to kind of keep with you as we move through this presentation. So when we think about colonization here in Hawaii, we can really think of two major players, right? The Christian missions, which marked the beginning of that profound cultural shift, also kind of marked the beginning of a new intellectual area, because that's when Hawaiians learned how to read, right? You know, give credit where credit is due. It was through the missionaries that Kanaka Maoli gained a written language, and it was primarily through the medium of reading the Bible. And then the other part to consider is the economic and political capital and the value of Hawaii in the global context, economically and politically, right? Because not only did we start growing sugar here and establishing a strong economic relationship with the United States, but Hawaii's location is very strategic and very coveted by global powers. And I'll talk about that in a little bit also. So, Christianity as a new faith, Hawaiians by nature, we are spiritual people. Everything in our culture is rooted and shaped around our relationship to Akua, to our Aina, and all of this. Everything is interconnected. And so, when Christianity arrived here in Hawaii, the concept of a religion wasn't foreign to Kanaka Maoli. It was just this idea of who the Akua is, right? And so when Christianity arrives in Hawaii, we see the ending of the kapu system, and that really marks the beginning of massive social change. And I want to point out too, right, with Christianity, there's a really strict gender binary that kind of comes with that. And Christian missionaries used religion as a tool to enforce gendered rules on Hawaiians. Now, I can kind of see everybody. Can you raise your hand if you've heard of Kapai Mahu? Beautiful. So Kapai Mahu, and I'm using this only as an example, right? That's something that's sacred to us as a people and what we understand historically, who we are in terms of gender, right? Well, that whole concept is out the window when we think about the arrival of Christian missionaries. And so I want to make the point also that when we think about Christianity arriving in Hawaii, I don't want to think about it in terms of a judgment on the faith and those who practice the faith. I really want to think of it in context of how it was weaponized against people, because that's really what the point is that I'm trying to make. Christianity and aikane. So the concept of sexual minorities, right, are people who are in aikane relationship or different types of relationship like punalua or po'olua. And these relationships are not sanctioned by the Christian missionaries who arrived here. And so already we can see the marginalization of anybody who practices an aikane relationship or who might have a punalua or po'olua relationship, or those who might be mahu and exist outside of this concept of the gender binary. We also see economic abandonment of subsistence. Before the arrival of missionaries and before sugar is really established as an economic power here in Hawaii, we practice subsistence agriculture, right? We have lo'i kalo. A lot of families and around their hale would have mala, their gardens, right? And so we knew how to grow for ourselves to make sure that we could provide for ourselves and for each other. The ahupua'a model is a very good example of how our lives were interconnected. You know, people who fishing out in the ocean and trading with people who might be hunting up mauka or who might be growing kalo in a lo'i, right, somewhere down the stream. And so that interconnectedness was really important to who we are as people and really important to our own ability to sustain ourselves. And so when we see a shift from subsistence agriculture to the growth of a cash crop, we lose the ability to feed ourselves and then obviously the ability to provide for ourselves and for our communities, and we become dependent on a new type of a new currency. And so with this shift to sugar growing or sugar as a new established economic force here in Hawaii, we see people getting displaced from their ancestral lands, right? Because what comes with that is the diversion of resources away from traditional homes. And so where the ahupua'a model is a good example of how interconnected we were, the disruption of the ahupua'a that came with the diversion of water really contributed significantly to the displacement of Kanaka Maoli, forcing people to work on plantations, right? You have no choice but to do that because how you gonna grow, how you gonna have a lo'ikalo without a stream, right? Because if all your water is being pulled away, you cannot do the same things that you did. And then another recent example that I want to share, Lahaina on Maui, traditionally an area with a lot of water sources, right? And now we see in modern times an example of what happens when that water is diverted away to other economic needs. And in modern days, that would be tourism and different from the sugar industry, but you kind of catch my drift. And then lastly, political motivation, right? So what happens when people start to get money and they start to grow their businesses, right? A corporation's function is to serve its bottom line and to grow its profits. And we have to remember, because Hawaii as a foreign country to the United States, their primary market was in the United States, and this is a foreign good, right? And so the United States placed a tariff on Hawaiian grown sugar, which was the impetus for sugar growers actually wanting to take over. Again, I'm oversimplifying everything, please excuse me, but really that tariff served as the impetus for the sugar growers to organize the coup against the queen. I want to make an additional point, right? Language erasure. From the time that the missionaries arrived in Hawaii, Hawaiians were the most literate society in the world. Over, like, I forget what percentage, right? 90 something percent of Hawaiians could read and write. And that is an incredible feat when you think about it. But with the shift in government, right, from Hawaiian monarchy to the provisional government to the Republic of Hawaii to United States territory, what happens is Hawaiian language gets banned in schools and it gets banned in public offices. So there's no real functional way to utilize Hawaiian. And so our kupuna actually encouraged their children to learn English. And we have a lot of stories, and this is part of our generational trauma. There are a lot of stories about families who refuse to teach their children Hawaiian because they did not think that their children could get ahead in this world unless they were efficient in speaking and writing English. Lastly, military dominance. I said lastly like 2 slides ago. Please excuse me. This one I promise is the last before we start to like put all the pieces together. Military dominance. Hawaii is the most militarized state in the United States because of the per capita stationing of various branches of service members here in Hawaii. And most famously, Pu'uloa, now known by Americans as Pearl Harbor, was bombed by the Japanese during World War II after the United States put an embargo on Japanese oil. And this is really damaging, right? And we all know the history. I know my tutu can recount the story of the bombing of Pearl Harbor from her own personal experience. But this is an example of how here in Hawaii, we are vulnerable because of the presence of the United States and just understanding that we are coveted just because of where we're located. So that was a lot. Let's put all of that together, right, in as simple terms as possible. So the rapid population decline because of the introduction of foreign diseases really destabilized our community enough to make people open to embracing a new faith. Prime example is Christianity. Christianity provided the foundation for American influence to really take hold here in Hawaii. And the children of the missionaries actually became the sugar growers. And the sugar growers who really took over the economy here in Hawaii. They were the ones who drove land privatization, which was the Great Mahele, and also drove were the driving force behind the overthrow of the Hawaiian monarchy, which resulted down the line in Hawaii becoming a United States territory and eventually a US state. And I do, before we start to move along a little bit further, to kind of get us a little more seated, right, in a, in our experience as Native Hawaiians existing in a US state, I want to read you this quote from Nikos Leverins, who is our Grants and Advancement Manager here at H3RC, because it perfectly captures our experience today. And we're going to see through the rest of the presentation how this is basically the result of colonization. We have to talk about the continued criminalization of poverty and behavioral health issues in Hawaii and elsewhere. The whole scope of our criminal legal system has Native Hawaiian people in its crosshairs, and it's been that way since territorial days. And in every stage of the process, from surveillance to arrest, through imprisonment, through reentry and supervision, Native Hawaiians are disproportionately impacted. So with that understanding, right, and I feel like if you were listening to me say that you can probably feel it kind of hit you in your na'au when that's said, because not only is it true, but it's also very heartbreaking, right? And in order for us to better understand that and contextualize it, we're going to look at some sociological perspectives that help us to really bring it into focus. So the first I want to bring up is a social theory from Frantz Fanon of Martinique, which was a French colony. And the population of people there, right, this is in Africa. And so they were a group of Africans that were colonized by a European power, by the French. And he wrote a book called Black Faces, White Masks, where his theory can basically be boiled down to we are Black, but we're expected to look or expected to behave like white people, which creates kind of this cognitive dissonance, right? Because this new power comes in and basically tells them that you are not okay, like as you are, you have to behave like us. And so Frantz Fanon wrote extensively about this concept of two different types of relations. Those of the colonized, right, the Africans who were engaging with each other, and then the second with how they engaged with their colonizers or their oppressors. And that's two different ways that they actually engaged. And for us here in Hawaii, it's a very similar experience, right? The way I talk to you guys here on this Zoom is going to be very different from how I talk about this subject anywhere in the continental United States. And I've talked about this in the continental US, and I'm so much more comfortable here. I just want to say that now. And so the social relations determine how, why, when, where people interact, and all of the rules that are set up around that. And so in healthcare, when we talk about representation from our community, having Hawaiians working in healthcare, whether as the doctor, the nurse, the social workers, at every level is so important, because the way that our community is going to relate to us is different from somebody who moves here from, say, Nebraska. And then Frantz Fanon also wrote about how an inferiority complex is imposed on the colonized, so that the colonizer culture is adopted amongst regular society, right? Which creates this whole dichotomy of what is appropriate and what isn't. And we see that a lot here in Hawaii, where it's not acceptable for us to behave as Hawaiians because we have to behave like Americans. White prejudice, that's a significant one, right? A deep-seated fear of uncivilized Blacks. That's how Frantz Fanon had kind of framed it. But we see it not just in his example in Martinique, but we see that in the United States. We see that here in Hawaii. We see it anywhere, right, where a community of color has been othered by those who have established control of that area. All right, so the next sociological theory that I want to talk about comes from Edward Said, who was born in Palestine. And I've seen his name kind of come up a lot lately, especially with the conflict that's been happening currently in the Middle East. So Edward Said wrote a book called Orientalism. And his theory of post-colonial, the sociological foundation of his post-colonial theory is rooted in the experience of Palestine and the Europeans who had colonized that area, which were the British. And so he talks about the Orient, which is the Middle East, well, technically the East, and the Occident, which would be the West. And so he wrote that there's kind of perverse thing happens where the people in the Occident present themselves as the experts on what's happening in the Orient. So suddenly the people who live in the Orient, in this case, the Palestinians, know less about their own condition of existence than the people in the Occident, which is really problematic, right? Because the experts are the people who are living through whatever is happening. And the same can be said here in Hawaii. How many times have I heard somebody tell me, oh, you should be grateful that the United States took you over and not Japan, even though like we could unpack that all day and talk about how incorrect and fallacious that is. But how many times I've heard that, or how many times people have tried to tell me what Hawaiian history is, and it's just mind blowing, totally mind blowing. Um, Edward Said wrote about colonial prejudice really being perpetrated against the colonized, like by creating this Christian and Muslim binary. And so in Palestine, right, the people who were Christian had social superiority over those who were Muslim. And that was perpetrated on them or forced onto them by the experience of colonization. Ah, yeah. Okay. So to move on from that. So with all that in mind, we're going to talk about the colonial impacts here in Hawaii. So religious implications, right? New religion dismantled the new religion dismantled the kapu system, very similar to Edward Said, right? We see this dichotomy between the good and the bad, the good being Christianity, the bad being the Hawaiian spiritual tradition. And then political implications, displacement of Native people away from their aina kupuna, from their traditional lands, to work, on sugar plantations, and political minority in our homeland. We are a political minority. We have been for quite some time. And this means that we have very little power, very little political power to leverage when it comes to voting, to the establishment of policies that might benefit us. Um, and I don't know if you noticed this, but like when Kuhio was advocating for Hawaiian homes in Congress, he was not a voting member of Congress. And he had to go and basically suck up to all these Americans and convince them that we needed to have access to these lands as Hawaiians. And he did that by telling them like how strong we are as people, how resilient, how good we are, and how much we deserved our land that had been taken from us. And so the fact that he had to do that to me just feels so wildly unfair, right? And then other economic implications, Native Hawaiians are not leading industry. How many of you can say that there is a Kanaka Maoli CEO of anything? Yeah, I don't know any either. As Hawaiians, we are employees and very rarely are we employers, right? We have growing small businesses, which I'm so excited to see. A lot of Maoli-owned businesses that are really starting to thrive, which is so exciting to me. But the fact of the matter is that for most industries, we are not the ones who are leading. And then poor economic prospects. We have no traditional subsistence, and that's from colonial days. But our poor economic prospects don't come directly from the old days. It comes from the systematic displacement of us over time. And then educational implications. We have poor access to educational opportunities, which means we have poor educational outcomes and poorer access to job opportunities. And then, of course, we have to talk about the social implications where our culture is sold as a commodity, right? Because 25% of our economy comes from tourism, and tourism in Hawaii depends on our culture in order to turn its profits. Traditional gender roles are at odds with Western expectations. So while we have this concept of mahu that comes to us from a very traditional place, we are consistently at odds with the Western concept of trans or gay or everything else, right, that falls under the rainbow flag. We have this concept of the ungrateful native, where if we are voicing our concerns and we are drawing the and we are connecting the dots between the past and the present, we're told that we're ungrateful or that we're stuck in the past or that we are not contributing to the larger solution, which couldn't be further from the truth. I just think that we know that our present day circumstances are rooted in our past. And so we are not afraid, we will not shy away from mentioning that. And we have this dichotomy of being Hawaiian and American. You got to be Hawaiian enough to represent Hawaii, but not Hawaiian enough to challenge the United States, not Hawaiian enough to challenge the US's control of this island, these islands, and the rest of the Pacific, but Hawaiian enough that you can dance hula for a tourist when they show up. And then lastly, significant health impacts and disparity. So that part, I want us to keep the disparity in mind because we're going to shift gears a little bit now that we've kind of talked about the sociological piece and we've talked about the history. Now I want to talk about the social determinants of health. So the social determinants of health are the non-biomedical, the non-medical factors that are related to health outcomes. And so we're talking about education, the access to healthcare, the neighborhood, what the social and community components of someone's life looks like, and economic stability. Now, these different things have profound impacts on health outcomes. And these exist outside the realm of what happens in a doctor's office or in an encounter with a nurse, right? So if you can just kind of imagine for a minute, you go in to see your doctor, and in that time that you're in there, right, you go, you check in, maybe they validate your parking, you go see your nurse, they put you on the scale, take your blood pressure, you go in, you talk to your doctor, they ask you what your issue is, and then they write you a prescription or they make a recommendation on a treatment plan or something, and then you're on your way out. But what does it take to get you to the doctor's office? Did you have to take off of work? Did you have to drive in? Did you have to catch the bus? How far away is your doctor's office from where you live or from your work, right? What if you have kids and your kids you don't have anybody to watch your kids, right? What if you don't have enough money to buy gas to get you to your doctor's office? What if your doctor's office validates your parking and you still got to pay $5, but you no more $5? These are the social determinants of health because everything that I just mentioned are opportunities for people to fall out of care if they're not addressed properly. So real quickly, right, education and education quality and access determines a person's health literacy, their job opportunities, and their social networks, right? Because where we go to school is important for community building. And the school that we go to can also pave the way for a different type of future. It also determines, right, what people are able to understand. Because I don't know if you ever talked to doctors, sometimes their language is like way too complex for me to understand. And either I'm asking them to explain it again, or I'm Googling it while I'm sitting in there with them. Healthcare quality and access to healthcare determines the level of care that a person can reasonably receive when they are able to get it and the extent to which it's useful. So, for example, if somebody has MedQuest, right, which is Medicaid, and you go to a doctor, so Medicaid is notorious for having really long turnaround times for reimbursement. And, it's a part of the system. And so there are kind of underlying assumptions from a lot of providers about Medicaid. And so if someone has Medicaid and their doctor might not want to accept Medicaid or might not be willing to take you in for an appointment, that's going to affect whether or not you're able to get in to see your doctor. The neighborhood and built environment determines somebody's security and safety, right? So do you have paved roads? Like I'm from the Big Island, like I grew up in an area that has a lot of dirt roads, right? And like it seems simple, but those dirt roads, you know what's not happening on dirt roads? Mail delivery. And a lot of people pharmacists get their meds delivered to them, right? So that's just something to think about. In rural communities, it's a huge deal. The social and community context determines, actually, there's one more thing I want to add to the neighborhood. Neighborhood can also relate to safety. So I want to draw the point, there's been a recent spate of gun violence out in Waianae, right? Here on Oahu. And when people are concerned about their safety, they're not thinking about their medications, their refills, because I can tell you if I'm emotionally distraught because somebody in my ohana was either killed or something like that is going on, like I'm not going to prioritize going to pick up my medication. I might skip my doctor's appointment if it was scheduled for the next day, right? So safety is very important in the context of healthcare. And then our community and social context. This determines the values and the beliefs that we have, the attitudes that we have about healthcare, about everything. And our social networks might also determine the level of support that we have available. So caregiving responsibilities, whether it be for keiki or for kupuna, that's all part of that. And then lastly, economic stability. And economic stability, the more money somebody has, the more access they have to childcare, to a job that has really good insurance, right? And notably, even the ability to take off of work because they might have PTO that they can use. And so all of these different things, all five of these are really interconnected, and one might impact another to varying degrees, but we have to think about the ways that our healthcare is impacted, not by just our doctor's visit, but what it takes us to actually get there and where we go once we leave. So in the HIV realm, we use this model in public health called the HIV continuum of care. And this really describes the steps from the time somebody is diagnosed with HIV to when they achieve a suppressed viral load. A suppressed viral load is determined by blood tests. And so if you're not familiar with HIV care, what happens is somebody, when they're diagnosed with HIV care, they get linked to a doctor, and then the doctor will run initial labs, and then they'll write a prescription for medication, and then the client or the patient will take the medication and do follow-up appointments with their doctors, and they'll do routine blood work to determine if they've achieved viral suppression. So viral suppression means that there are not enough copies of the virus in the blood for the test to read. And so we call that either undetectable, and it's still considered a suppressed viral load if it's below 200 copies. But the reason this is the gold standard is because when somebody achieves an undetectable or a suppressed viral load, they don't risk transmitting HIV to anybody else. And so this is also the area where people start to see really positive health outcomes. They start putting on weight again. They start, any type of like secondary infections start to go away. Everything gets better. And then at this point, people can live a regular lifespan and achieve a quality of life that was never known prior to the advent of antiretroviral therapy. So the thing that I want to pinpoint on this continuum, though, in each of these steps, there's opportunities for clients to fall out of care. So I've experienced in my time as an HIV tester, somebody tests positive and we try to get them in to see a doctor. But one time this person just up and left. They up and left as I was calling a doctor's office to set an appointment. That's a really extreme situation, but it happens, right? Or we set an appointment with the doctor and then the person doesn't show up. They don't go to see the doctor. And so I've gone to actually pick people up and take them to the doctor just to make sure that we're not missing that opportunity. Now, what happens when somebody gets a medication? Well, they take their medication, but what it takes to continuously take a medication every day, it seems like a really simple task, but it's really not. It starts off easy, right? People oftentimes they get motivated, they get educated about the medication. I want to take this med, I want to get healthy, and things are going to be okay. But life happens. Things happen. People become complacent, priorities start to shift. It's really easy. And like just from personal experience, as somebody who takes so many different medications, like there are times when I like forget that if I've taken my meds, so I keep backups with me whenever I'm like going somewhere because things happen, right? Life happens. People can forget. But that complacency, if it's not monitored and kind of kept in check, it can really start to grow and snowball into something else. Now, let's look at Kanaka Maoli, our ʻŌiwi communities, and HIV. Our kane are 2.6 times higher or have 2.6 times higher infection rates than their white counterparts. Our wahine, 2.4 times higher than white counterparts. Our mahu, we have no data. Our kane are 1.9 times higher, have 1.9 times higher AIDS diagnoses than their white counterparts. Our wahine, 1.2 times higher. Our mahu, no data. Our wahine, 2.5 times more likely to die of AIDS than white women. That is a staggering number, and it's appalling. And our mahu, no data. This is really important for us to consider because in terms of a colonial healthcare system or a healthcare system that comes to us from outside of Hawaii, there's no way for us to capture this data accurately, right? There are ways if we're committed, but currently there are really insufficient methods for capturing this data. Our disparities in our ʻŌiwi community are rooted in colonialism. Because that political change that happened during the overthrow and everything that's happened since, that change is responsible for the circumstances we are experiencing today. Because everything that led up to it led to our displacement, the diversion of resources we needed to sustain ourselves. You know, that rapid population decline, right? Destabilizing of our communities and our family structures. Colonialism paved the way for many of these health crises. And our disparity is a response to this cultural shift. We're a loving people, right? We very aloha. And before contact, our people, they was having all kinds of sex, right? Any kind. And I say that jokingly because that's just how we were. And to be perfectly honest, that was how so many of these different STIs, you know, chlamydia, gonorrhea, syphilis, were able to spread through our communities because of sexual contact. But what happened with the introduction of Christianity was really our people being shamed into secrecy, not talking about the types of relationships that they're having, the type of sexual activities that they're, which really limits our ability to help when our jobs are geared toward assessing risk related to sexual behaviors. And not only that, but I do want to make mention that there's a history of mistrust for public health here in Hawaii, and a lot of it comes from Hansen's disease. So I don't know if you folks are familiar with the Hawaiian name for Hansen's disease or leprosy. It was called Kama'i ho'oka'awale ohana, which means the family separating sickness. Because when people were people were suspected of having Hansen's disease, they were pulled away from their families, put into hospitals, and oftentimes sent to Kalaupapa on Molokai, where they would never see their ohana again. So we have a lot of stories of people who would take their families, right, and they would run away because they didn't want to be separated. Because ohana is very important to us. That is something, that is a value, a cultural value that we've never lost. And in terms of family, the idea of the nuclear family is an incomplete model for Hawaiians. And I just have to say that the American system puts heavy emphasis on the nuclear family, but it is an incomplete model for Hawaiians. So knowing all of this, right? So much different stuff happening and like so much information to digest. How do we actually decolonize our HIV care? What is the work that we're doing to actually improve these outcomes, right? Because that's the ultimate goal, is to get some equity in all of this. We have to first acknowledge our limitations. Our systems are built for heteronormativity and the sexual majority. So people who are straight, who are cisgendered, who don't exist outside of the gender binary, data doesn't capture our needs accurately or our experiences. And so in public health, we look at HIV very black and white and very clinical, right? What are the behaviors that lead to HIV transmission? But we also have to capture the cultural nuances that influence how these different behaviors are actually being carried out. And then we have to acknowledge that the medical system doesn't recognize the value and impact of native treatments and native forms of healing. And this is important because when our ways of life and our modalities of healing are not acknowledged and we hold them very special to us, we're not going to engage in a system that consistently puts it down. So we have to expand our capacity, right? Our data systems need to be updated, and there are ways to do this, right? Electronic medical records can be adjusted so that drop-down menus include things you can add in additional demographic questions so that we can create data systems and integrated processes that collect information accurately. And not just accurately, but with the type of nuances that we want to capture, right? So that requires an investment in time, it requires an investment in money, but it is important if we're trying to look at this through a cultural lens and trying to look at our data outside of what the Western norm currently is. We have to evaluate our processes and implement changes for intakes, for service delivery, and for care planning. Care planning, if you are anybody who has like a background in nursing or in social work, understands like what a treatment plan is or what a care plan is. In our care plans, right, there are ways to capture things that are cultural and important to us without othering it. So I have seen care plans that say cultural, and people will put in there things like hula, oli, and all of this, or paddling. But those can go into like a different category, right? Because hula has been shown to have significant physical benefits as well as mental health benefits, as well as psychosocial support. Same can be said for paddling and group activities. Those don't have to go into recreation. They can go into your more major categories that you're trying to capture information for. And so when we do that, the why that's so important is because it validates the importance of those activities to the person and to their engagement in the medical system. Equity. Equity is a huge deal, right? The difference between equality and equity is significant and important for us to understand. Equality means that we gave everybody the same thing, right? Wash my hands a bit. Okay, tall. Equity is really about giving people what they need in order to achieve the same goal. And so as this image kind of demonstrates, right? For equality, we gave everybody one box. But the tall guy, he never need that box, right? The girl, she's still kind of struggling to see over the top. But what about the kid in the wheelchair, right? That box doesn't do that kid any good. But if we use equity, right? Tall guy, he don't need the box. So we're going to give two boxes to the girl and we're going to build a ramp for our kid in a wheelchair. That way, everybody can see over and watch the game the way that they need to. And so for us in HIV care, equity means that we are focusing our resources where our community needs it. So we here at H3RC, there is a program called Kiolapono, which is housed in our case management department, our case managers who work with people living with HIV. And my coworker Kelly, he refers to it as case management without walls, where we take our Hawaiian clients, right, and we go and do like a retreat. And we engage in different activities that are culturally rooted. So most recently, we were in Ka'a'awa and making laulau. And this whole time, we're not talking about, oh, did you take your meds? Like, did you take your meds over every day for the last 4 days? We're not asking those questions. We're engaging with them and teaching them about about the relationship of haloa to our people, right? Because when you wrap your laulau, that's your luau leaf, that's haloa right there, right? And why is that important? Why is that significant to us? But you see this pilina start to form among the clients, and you see people start to engage with their case managers who are there differently because we're not talking about their medical care. We're talking about who they are as people and building that relationship. Because in case management, the relationship itself is the resource. And so when we think about healthcare, right, and accessing healthcare, clinical healthcare is a business, bottom line. It can be very complicated. It's super convoluted, right? Doctors using all different kind of language, so it's hard to understand sometimes. It requires multiple payers, right? So insurance companies, patients are paying also. It requires, or it's not built with Indigenous peoples and needs in mind. So if hula has been something that's super important to me since I was a kid, right? If hula might not be acknowledged by my medical provider. Clinical healthcare does not acknowledge the validity of Indigenous knowledge systems. It can be prohibitive. It can be subject to ever-changing political agendas, especially for people who are on Medicare and Medicaid. It's because no matter what, we are at the mercy of whoever happens to be in power at the United States Congress, the presidency, right? Because those are the people who are making the rules about socialized healthcare for people who are low income or aging or who are disabled, right? And a significant number of our people are disproportionately impacted by poverty, by having a disability, or in aging. We also have to remember that clinical healthcare is an extension of colonial forces. And so there's a power dynamic that exists between those who have healthcare to offer and those who need access to the healthcare, which is why representation is so important in the healthcare system. By having Hawaiians serving Hawaiians, you have an opportunity to kind of eliminate the power dynamic. Well, truthfully, the power dynamic will still be there, but you have an ability to overcome that relationship building that sometimes the differences well that sometimes the differences between people who move here and our local community will experience. And lastly, clinical healthcare often reinforces stigma. So HIV is a really unique disease experience in that it is wrapped in stigma that is really, really powerful. Stigma that keeps people out of care, disengaged from services because they don't want people to know they have HIV. Because then that means, oh, they must be either a drug addict or they must be gay or they must be promiscuous in some way, right? And so if all of these preconceived judgments exist, people are not going to access their healthcare. On the Big Island, we had a lot of people who didn't want to be seen coming into our office, right? Because their auntie works Taco Bell, which was right in front of the office I worked at, or their uncle was a pharmacist at Long, so they didn't want to pick up their meds. And that's really huge, and not just on the Big Island where I live, but that's a significant issue on Maui, on Kauai, and even here on Oahu. So some additional solutions, right, is reconnecting with our culture and embracing the cultural perspective that validates who we are as people. And oftentimes that means validating the gender experience, right? Mahu and transgender are not the same thing. We can get kind of close in description, but they're not. Mahu comes with kuleana, and so understanding that kuleana really is paramount for our Mahu community, whereas trans is more of a Western label, right? Earlier, I made mention that there's no data for Mahu. We have some data for transgender, although the way that we capture data for transgender people is still very flawed. And so I don't want to really make mention of it because I don't want to conflate the two experiences because they still are different. Another solution is to acknowledge the history of exploitation and displacement as motivation to improve social circumstances. We can get involved, right, at the legislature. We can get involved in our communities. We can take action in our communities to make small changes, right? The things we do, they don't have to be really big things. They can be small things, right? Getting involved with your local halau or getting involved in a hui, a paddling hui or something, because anytime you get involved with something, what inevitably comes with that is kuleana. And having kuleana is so rewarding for Kanaka Maoli. Kanaka Maoli representation in the healthcare system, I've already beaten this point to death. Intentional inclusion of cultural practices that affirm deeply rooted identities. So like I was mentioning with the care planning, right? When you acknowledge those pieces of culture that are valid and relevant to multiple dimensions of care, people are more likely to remain engaged because they feel seen, right? They feel validated. And lastly, respecting cultural boundaries. So this is a really big one to me, for non-native providers providing care to people who are Kanaka Maoli, right? Respecting that cultural boundary. And that in turn means that I have to be respectful of cultural boundaries when I work with communities that are not Native Hawaiian. So what immediately comes to mind for me is our Micronesian communities, right? I have to be mindful and respectful of the cultural boundaries that they have. And it also means that I have to be sensitive to it and pay attention. And so as a service provider, that remains front of mind for me. And I do want to point out, if you want some data that's related to our trans population, this fabulous report came out in 2018 from the Hawaii Sexual and Gender Minority Working Group that was focused on transgender healthcare and transgender youth. And this is a really great report. You can find this on the Department of Health's website, or just type that name into Google and it'll pop right up. But this is a great resource for collecting data specific to trans people. And there's also another report that is for lesbian, gay, and bisexual people as well. Because I know that we all love data in some ways, so definitely want to make that known. Whew. But anyway, that was quite a bit. That kind of brings me to the end of my presentation. I know that we have it's only 10:48, so I guess if anybody has questions, I'm happy to answer any questions that you might have.
Aloha, I have a question.
Hi, yeah.
Why is there no data for Mahu?
That's a good question. So there's no data for Mahu because Mahu are not captured in data. There is, and I want to make that the point, right? There's a distinction between Mahu and trans. And so while we have really clean kind of references for Kane and Wahine as men and women, we don't have a very clean like alignment for trans and Mahu, right? Because Mahu is not necessarily trans. Like I'm Mahu, but I'm not trans. You know what I
Right.
mean? And so the totality of that experience is not really captured. To me, it's a really simple fix. I think that our data systems can just add a question, are you Mahu? And that
Right.
would allow us to disaggregate and to separate who is and who is not, and how those experiences might be impacted.
Well, I hope that that can happen soon. What's the political holdup on changing the data collection system?
So that can happen in a couple of different ways, right? So individual agencies can update their own electronic medical records. So that takes, that really depends on the capacity of the agency itself. In terms of data collection for the state goes off of very they do collect their own data, but they do depend on national indicators, right? Which don't really, I guess, speak to our population very much, especially because, like, nationally, Native Hawaiian and Pacific Islander are aggregated and they should be disaggregated for our community here. Um, but yeah, I think it would take legislative change, and that's something I would be happy to advocate for. But yeah, right now, I think the easier lift would be individual agencies because state is notoriously bad at moving things along quickly.
Thank you for that. I was wondering if it was a state or federal issue or if it was, an easy fix. Obviously, it can't be that easy, or you folks would have done it already, but um
Yeah,
that
yeah, yeah. But good question though. I mean, it's so important. And if I'm being honest too, I think that there are, I think the interest and the interest in Mahu data collection, even though there has been like a desire to see that. Like I feel like there hasn't been much concerted effort until fairly recently. Um, like around 2015-ish, when I started working in HIV care, a lot of like trans groups would come together. And then there was a group called Ka'ahamahu, which is hosted by our Kua'ana project here that has participation from across the Pai'aina. They they were really the ones who started to move forward. They're the ones who are the reason that report exists for trans people, because the first report came out for lesbian, gay, bisexual people, and they were like, "Where's your trans data?" And so that I think is probably like the beginning of like real serious concerted effort to get data. But now we're understanding that there has to be division between Mahu and trans because they're not necessarily interchangeable. So I would say it's relatively new, but yeah, it needs some work.
Aloha, it's Mia from Maui. I would have
Aloha.
to agree that each agency has to kind of do their own work because we recently changed our intake documents to reflect not only male and female, but also asking, more information, but I'm not sure how it's shared. Yeah.
Yeah.
And even our PHI, like the information that um, our client wants us to share, it actually asks a question like, do you want us to share HIV information or not? Yeah. So I think, yeah, if
Nice.
each agency does their own information, data collection and able to submit it too, right?
Mhm.
To somewhere that's more statewide.
I love that. I love that you updated your intake documents and all of that. So important. So important.
Yeah, because we Child and Family Service on Maui is the sexual assault center, and so yeah, we are a safe place and space for anyone to come and get help for whatever is needed.
Beautiful.
But thank you for sharing. It's so important that it's not just like one need. There's also like there's multiple needs, right? Among asking for help.
Yeah, absolutely. Well, thank you so much, everybody.
Thank you so much.
Thank
Appreciate your time.
you. Hello.
Thank you so much for coming, you folks.